The availability of medical information online has changed the way that both patients and medical professionals seek information. The search engine Google is used to conduct over 1 billion health-related searches a day, 70,000 searches every minute. This is important because these searches can have a direct impact on healthcare outcomes. Faster, more effective searches by physicians can lead to better patient care, and study has found that patients who conduct online searches for medical information ask more questions during their appointments and can be more willing to comply with medical advice. This presentation will discuss a variety of medical databases, the online search behavior of both medical professionals and healthcare consumers, and how information professionals can improve health outcomes by contributing to better online searches. There are a number of databases available to search for medical information online, and they can be divided into professional databases meant for scholarly and clinical research, consumer databases meant for patient and consumer education, and search engines. Two examples of professional medical databases are Medline and Embase. Medline is a freely accessible bibliographic database of the National Medical Library. It includes 26 million references to articles from 5,200 journals that have been approved by the National Institutes of Health. Medline is searchable using a controlled vocabulary called MESH, which is updated with new terms yearly. The materials in Medline can be searched via PubMed, a free full-text archive, also supported by the National Library of Medicine. In 2019, the database contains 6 million records, and they reported an average of 2.6 million unique sessions on weekdays. Embase is a subscription database that includes all of the materials in Medline and around an additional 2,900 journals and 6 million records. Embase uses a proprietary controlled vocabulary based on MESH called Emtree. Emtree has a much larger set of preferred terms, around 82,000 to the 27,000 included in MESH. This is in part because Emtree has a larger pool of terms dedicated to medical equipment and medications. Emtree is updated 3 times yearly. Two examples of consumer databases are WebMD and Medline Plus. WebMD is a provider of online medical information with a database of articles and answers to medical questions created by physicians. The website has 75 million unique views each month. It's free to use and supported by advertisements and sponsors. Medline Plus is also a free database of medical information, but unlike WebMD, it is funded by the National Institutes of Health and the National Medical Library and accepts no advertisements or endorsements. Search engines like Bing, Yahoo, and Google are frequently the first method a searcher uses to find information. In 2013, 72% of Americans reported searching online for health information, and of them, 80% began their search with a search engine like Google. Physicians need ready access to current and accurate information to provide patient care, because referring to information from primary sources is an important component of evidence-based medical practice. However, among medical residents, one study found that looking to primary sources via a web search was a last resort for information seeking, utilized only after asking colleagues or attending physicians, checking a pocket reference guide, asking office staff, and referring to a comprehensive print text. Practitioners report using online search tools primarily for day-to-day clinical queries or to prepare for an academic or professional presentation. The most important factor for physicians searching online is speed. One study of family practitioners found that it was rare for a resident or faculty member to spend more than 2 minutes looking for an answer to a question, even those they considered very important. Most physicians cited medical databases such as PubMed as their first choice for an online search, but for 20%, Google was their first choice. They tended to conduct very simple searches. A study found that physicians use MESH headlines very infrequently and rarely use Boolean operators. In a study, almost a quarter of practitioners said they practically never use the MESH headings. Nurses who would choose to use an online search for medical information often state there are factors that prevent them from doing so, including a lack of skills and training, a sense of urgency and lack of time, and not having access to a computer in the moment of information need. The availability of medical information on the internet has made online searching an important tool to help patients make medical decisions. In many cases, online searching to self-diagnose acute symptoms helps a patient decide whether or not to seek medical care. The most common reasons for an online search for medical information are to become more informed, for help with managing a chronic condition, or to clarify the information given to them by a medical professional. The primary barriers to good search for patients seem to be a lack of medical vocabulary and an inability to synthesize information from multiple sources. In a 2019 study, people without medical knowledge were asked to perform web searches to find specific answers to a series of medical questions. The answers they produced were then rated by physicians for accuracy. While all study participants were able to locate reliable sources online, more than half of the answers they generated were considered incorrect by the physicians. The use of medical terminology and jargon seemed to make searches more difficult for users. Finally, access to databases and resources can be an obstacle. About a quarter of survey respondents reported that the health information they were looking for online was behind a paywall or subscription. Of those who were asked to pay, only 2% did so. 13% of those who hit a paywall said they just gave up. Many healthcare consumers will choose public libraries to access medical information. Public librarians should be encouraged to take advantage of continuing education and health information so they can confidently help library patrons perform searches. Programs exist to prepare librarians with the required skills, ranging from train-the-trainer style workshops led by medical librarians to sessions at industry meetings. Information professionals can also contribute to improving physicians' online searches by providing needed training to medical professionals in the use of online resources to access evidence-based medical information. In one UK study, 70% of physicians felt a need for database training, and those with training in search did produce better results. Information professionals can also assist healthcare consumers in improving their search accuracy by helping them evaluate different online sources. Resources such as the Evaluating Internet Health Information tutorial published by the United States National Library of Medicine are effective tools to help searchers increase their information literacy skills. The tutorial guides searchers to ask questions to evaluate potential sources of information and provides detailed sample websites to use as examples. Information professionals can also direct searchers to free and open source resources like PubMed and instruct them how to use library logins to access paid journals so that they have options when they encounter paywalls.